Module 8. Infection Control and Safety Practices. The objective of this class is to equip caregivers with the necessary knowledge and practical skills to prevent and control infections in caregiving environments. The lessons focus on key infection control practices and safety measures for both caregivers and clients. Lesson 1. Standard Precaution for Infection Control. Lesson 2. Preventing Exposure to Bloodborne Disease. Lesson 3. Safely Managing Contaminated Materials in the House. Lesson 1. Standard Precaution for Infection Control. Objective: educate on the essential standard precautions that all caregivers should follow to reduce the risk of infection and maintain a safe environment. Standard Precaution. Standard precautions form the basis of infection control, safeguarding caregivers and clients by reducing the risk of transmitting infectious agents. Proper hand hygiene and the use of personal protective equipment, PPE, like gloves, masks, gowns, goggles, and face shields to prevent exposure to blood, bodily fluids, and contaminants. Standard precaution. A. Hand washing. Hand washing is the most effective way to prevent infection. Perform hand hygiene with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer with at least 60% alcohol when soap and water are unavailable. Focus on cleaning fingertips, under nails, and between fingers. When to perform hand hygiene: before and after direct client contact, after removing gloves or PPE, before preparing or handling food, after using the restroom or handling waste. Proper hand washing steps. Prepare for hand washing. Gather necessary items like soap, paper towel, or access to an air dryer at the sink. Wet your hands. Turn on warm, clean water. Wet your hands thoroughly. Apply soap. Dispense enough soap to cover all hand surfaces. Lather and scrub. Rub your palms together to create a lather. Scrub between fingers, on the backs of your hands, and around your wrists. Clean under your fingernails by rubbing your fingertips against the opposite palm. Scrub for 20 seconds. Continue scrubbing for at least 20 seconds. Sing happy birthday twice as a timer. Rinse thoroughly. Rinse your hands under warm, running water. Keep your fingers pointed downward to prevent recontamination. Dry your hands. Use a clean disposable paper towel or an air dryer to dry your hands. Prevent recontamination. Use a paper towel to turn off the faucet. If necessary, use the same towel to open the door. Moisturize. Optional. Apply hand lotion to prevent dryness and maintain skin health. If soap and water are unavailable, use a hand sanitizer containing at least 60% alcohol, and apply the sanitizer to your palms and rub all hand surfaces until dry. Standard precaution. Personal protective equipment, PPE. Personal protective equipment, PPE provides protection against exposure to blood, body fluids, and infectious agents. PPE serves as a critical barrier, protecting both caregivers and clients from cross-contamination and infection. Single-use PPE should be disposed of immediately in designated waste containers, while reusable items, like goggles, must be cleaned and disinfected according to facility guidelines. Proper selection and use of PPE, including gloves, gowns, masks, goggles, or face shields, are crucial for minimizing exposure to infectious materials. Standard precaution, PPE, gloves. Gloves prevent viruses from entering through skin cracks and disposed of after use, followed by hand washing. Gloves are essential for protecting caregivers from harmful pathogens during client care, and when handling contaminated materials, they should be worn and disposed of after a single use, and never reused to ensure safety. Always wash hands before putting on gloves, and after removing them to prevent cross-contamination. Proper glove removal is crucial to avoid spreading pathogens from the outer surface. Proper glove removal process. Glove removal should be done carefully to prevent cross-contamination. The outside of the gloves may be contaminated, so it is important to avoid touching it directly. Grasp the first glove. Using one gloved hand, pinch the cuff of the other glove and carefully pull it off inside out, keeping it crumpled in a ball as you remove it. The outside surface of the glove should be inside the ball, preventing contamination. Remove the second glove. With your bare hand, slide 2 fingers under the cuff of the second glove, ensuring not to touch the outside surface. Pull it inside out over the first glove, trapping the first glove inside. This prevents exposure to the contaminated outer surfaces. Wash hands thoroughly. After disposing of the gloves, wash your hands thoroughly with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol. Dispose of gloves safely. Place the gloves directly into a designated waste container immediately after removal. Do not leave them on counters or in non-designated areas. Standard precaution, PPE, masks. Masks are essential for protecting caregivers from respiratory droplets, splashes, and airborne pathogens. They should be worn in situations such as during procedures involving respiratory secretions. Wear masks during tasks like suctioning, mouth care, or intubation. When caring for clients with airborne illnesses, use N95 respirators or similar respirators when caring for clients with airborne infections like tuberculosis or COVID-19. Close contact with coughing or sneezing clients. Always wear a mask if in close contact with clients who are coughing or sneezing. Types of masks and their use. Surgical masks. Purpose. Surgical masks are designed to prevent the transmission of droplets from the wearer to others, and to protect against exposure to respiratory secretions. Use. Surgical masks are essential in situations where droplet transmission is a risk, such as during close contact with clients who are coughing or sneezing, and for general care tasks. Respirators, e.g., N95 masks. Purpose: N95 respirators are designed to filter out airborne particles, including viruses and bacteria. They provide a higher level of protection compared to surgical masks. Use. N95 masks are necessary during airborne precautions, such as caring for patients with tuberculosis, measles, or other airborne diseases. They should be worn when the risk of exposure to infectious airborne particles is high. Standard precaution, PPE, gowns, aprons. Gowns or aprons are crucial for protecting skin and clothing from contamination by bodily fluids. They should be worn during activities with a risk of splashes, sprays, or significant contact with infectious fluids, such as wound care, cleaning, personal care assistance, and handling soiled items. Gowns provide a barrier to reduce infection risks by shielding the caregiver's skin and clothing, ensuring hygiene and cleanliness in caregiving environments. Standard precaution, PPE, eye protection. Eye protection, such as goggles and face shields, is crucial for preventing exposure to splashes, sprays, and respiratory aerosols. They should be worn during tasks with a high risk of fluid splashes, such as wound care, cleaning, or hygiene procedures, and during airborne exposure to clients with respiratory illnesses like COVID-19 or tuberculosis. Proper use of goggles or face shields is crucial for effective protection. Types of eye protection. Goggles. Purpose: goggles are designed to protect the eyes from direct splashes or sprays of infectious fluids, dust, or debris. Use. Wear goggles when performing tasks like cleaning contaminated surfaces, assisting with personal care, or during procedures that may cause bodily fluids to splash into the eyes. Face shields. Purpose: face shields provide full face protection, covering not only the eyes but also the nose and mouth, offering more comprehensive protection than goggles alone. Use. Face shields are ideal for situations involving significant exposure to fluids, sprays, or infectious aerosols, such as during surgeries, wound care, or when caring for clients with respiratory infections. Proper use and care of eye protection. Ensure they are securely fitted to cover the eyes and face, preventing exposure to infectious materials. Remove them carefully by handling the straps or sides to avoid contact with contaminated surfaces. Clean and disinfect reusable eye protection after each use, following facility guidelines. For single-use items, dispose of them immediately in a proper waste container to maintain safety and hygiene. Reusable goggles and face shields must be cleaned with soap and water, then disinfected with an alcohol-based solution or approved disinfectant after each use. How to put on PPE. Donning. Perform hand hygiene. Wash your hands with soap and water or use an alcohol-based hand sanitizer. Put on gown. Secure the gown at the neck and back, ensuring it fully covers your torso, arms, and legs. Put on mask or respirator. Place the mask over your nose and mouth, securing it snugly under your chin and around your ears or head. For respirators, example, N95, perform a seal check. Put on goggles or face shield. Position goggles or face shield to cover your eyes and face, ensuring a secure fit. Put on gloves. Choose gloves that extend over the gown's cuffs to provide a complete barrier. Doffing. Taking off PPE. How to remove PPE. Doffing. Remove gloves. Grasp the outside of one glove near the wrist. Peel it off inside out, and hold it in your gloved hand. Slide your ungloved fingers under the wrist of the remaining glove. Peel it off inside out, and discard. Remove goggles or face shield. Handle only the straps or sides to avoid touching the front. Remove gown. Untie the gown or release fasteners, touching only the inside while pulling it away from your body. Roll it inside out and discard. Remove mask or respirator. Handle only the straps or ties. Avoid touching the front of the mask or respirator. Perform hand hygiene. Wash hands thoroughly with soap and water or use an alcohol-based hand sanitizer. Lesson 2. Preventing exposure to blood-borne disease. Objective. Teach caregivers how to protect themselves from blood-borne pathogens, such as hepatitis B, hepatitis C, and HIV by understanding how these diseases are transmitted, and following appropriate safety protocols. Understanding blood-borne pathogens and transmission. Blood-borne pathogens are infectious microorganisms present in blood and other bodily fluids. These pathogens can cause a range of diseases in humans, including hepatitis B, hepatitis C, and HIV. Caregivers are at risk of exposure to blood-borne diseases like hepatitis B, hepatitis C, and HIV due to their close interactions with clients, particularly when handling bodily fluids or contaminated materials. Due to the potential for transmission through contact with contaminated blood or fluids, caregivers and healthcare workers must take precautions to protect themselves from exposure. Blood-borne pathogens transmission. Direct blood contact. Pathogens can be transmitted through open wounds, cuts, or mucous membranes when they come into contact with contaminated blood. Blood-borne pathogens transmission. Needle stick injuries. Accidental punctures by needles or sharp objects that have been contaminated with infected blood are a significant risk for transmission. Blood-borne pathogens transmission. Splashing of bodily fluids. Exposure can also occur if bodily fluids, such as blood or other fluids, splash into the eyes, nose, or mouth. Blood-borne pathogens transmission. Shared equipment. Using contaminated medical instruments or devices, like needles or surgical tools, can also transmit pathogens. Bloodborne pathogens transmission, sexual contact and vertical transmission. While less common in caregiving settings, these routes, through sexual contact or from mother to child during pregnancy or childbirth, are additional ways blood-borne pathogens can be transmitted. Safety protocols. To reduce the risk of exposure to bloodborne pathogens, caregivers should follow standard precautions, assuming that all blood and body fluids are potentially infectious, regardless of the patient's known health status. This ensures that caregivers take the necessary precautions in all situations. Personal protective equipment, PPE, is essential. Caregivers should wear gloves whenever there's a risk of contact with blood or bodily fluids. Gowns or aprons are needed for situations with potential splashes, and masks or face shields should be worn when there's a risk of fluid splashing into the face. Hand hygiene is critical. Caregivers should wash hands after removing gloves or touching any potentially contaminated surfaces to prevent the spread of pathogens. When soap and water aren't available, hand sanitizer can be used. Safety protocols. Cleaning and disinfecting surfaces and equipment that may have been exposed to blood or bodily fluids is also essential. This helps reduce the risk of pathogen transmission to other patients or staff. Caregivers must dispose of contaminated materials like gloves, bandages, and sharps in properly labeled, puncture-resistant containers. This helps prevent accidental exposure and ensures safe handling. Vaccination. Hepatitis B vaccination is recommended. The hepatitis B vaccine, consisting of 3 doses, offers effective protection against HBV. Bloodborne disease. Proper handling of sharps. Avoid recapping needles. Recapping increases the risk of accidental puncture. Dispose of sharps immediately. Place used needles and other sharp objects in puncture-proof, labeled sharps containers. Report injuries promptly. If a need stick injury occurs, follow your facility's exposure protocol immediately. Safe handling and disposal of waste. Safe handling and disposal of waste involves segregating infectious waste, such as contaminated gauze, gloves, and items exposed to blood, using biohazard bags. Caregivers should follow local and facility guidelines for the proper disposal of biohazards waste to ensure safety and prevent contamination. Emergency protocols in case of exposure. In the event of exposure to blood or bodily fluids, it is essential for caregivers to act quickly and appropriately to minimize the risk of infection. Exposure response. If exposed, wash the area and report the incident immediately. For skin exposure, wash the affected area immediately with soap and water to remove any pathogens. If exposed to the eyes, flush them with running water for at least 5 minutes to clear infectious material and reduce the risk of infection. Any exposure to bloodborne pathogens should be reported to healthcare personnel or a supervisor right away to ensure timely follow-up care, including post-exposure prophylaxis, PEP, particularly for conditions like HIV or hepatitis B. Wearing the correct personal protective equipment, PPE, such as gloves, masks, gowns, and eye protection, is essential for preventing exposure and safeguarding caregiver health. Lesson 3. Safely managing contaminated materials in the house. Objective: provide guidelines on how to handle, dispose of, and clean contaminated materials to reduce the spread of harmful germs, and protect the health of both caregivers and clients. Safely managing contaminated materials in the house. When handling soiled items in the home, caregivers must take precautions to prevent contamination. Always wear gloves when handling soiled materials like sheets, clothing, or cleaning supplies, and avoid direct contact with skin. Dispose of contaminated items in a sealed bag or container and wash hands thoroughly afterward. Use appropriate cleaning solutions and disinfectants to clean surfaces and materials. Safely managing contaminated materials in the house. Safe handling and disposal of contaminated materials, such as soiled linens or medical waste, is vital to prevent the spread of harmful germs and protect both caregiver and client health. Following proper protocols helps reduce the risk of infection and ensures a safe and hygienic environment. Contaminated materials include soiled clothing, bedding, towels, disposable items like gloves and tissues, medical waste such as sharps and bandages, and surfaces or objects exposed to bodily fluids. Handling these materials poses risks, including exposure to bloodborne pathogens like hepatitis B, hepatitis C, and HIV, as well as the spread of bacteria and viruses that can cause gastrointestinal and respiratory illnesses. Proper handling and disposal are essential to reduce these risks and maintain a safe environment. General safety guidelines. Always treat bodily fluids and contaminated items as potentially infectious. Wear gloves when handling or cleaning soiled items. Use masks and face shields to protect against splashes. And wear gowns or aprons to safeguard clothing during cleanup. These precautions help prevent contamination and exposure to harmful pathogens and ensure safety. When handling contaminated materials, caregivers should use disposable supplies only once as directed to prevent cross-contamination. Segregate waste properly by using biohazard bags for infectious waste and general waste bins for non-contaminated items. Check local regulations, or consult your supervisor for sharps disposal guidelines. Proper disposal of waste. Regular garbage. It's important to avoid compacting trash with your hands or feet to prevent accidental exposure. Non-sharp contaminated items, like tissues, gloves, and wipes, should be carefully placed in 2 plastic bags for extra protection. Make sure the bags are sealed tightly to prevent any leaks or spills during disposal. This extra layer of security ensures that contaminants don't spread and helps maintain a hygienic environment. Proper disposal of these items is a key part of minimizing the risk of infection and maintaining safety in caregiving settings. Proper disposal of waste. Contaminated waste biohazard. Contaminated waste, such as items exposed to blood or bodily fluids, must be separated from regular trash to prevent cross-contamination and ensure safe disposal. For large quantities of contaminated waste, use red biohazard bags clearly marked with the appropriate symbols. These bags are specifically designed for safe handling and disposal of potentially infectious materials. In cases where significant amounts of biohazard waste are generated, arrange for disposal through local medical waste disposal services to ensure proper handling and compliance with health and safety regulations. Proper disposal of waste. Sharps. Dispose of syringes, razors, or other sharp objects in designated sharps containers, not regular garbage, using puncture-resistant, hard plastic containers. Do not overfill sharps containers. Seal them when they are 3/4 full. Follow local waste management regulations for disposal. Never recap needles or bend them by hand to prevent accidental injuries. Always use labeled, puncture-proof containers, and report and document all needle stick injuries promptly. Cleaning and disinfection. Cleaning surfaces contaminated with bodily fluids. Use disposable towels to wipe up visible spills, and apply disinfectant effective against viruses and bacteria. Follow the manufacturer's instructions for dilution, application, and contact time to ensure effective disinfection. Cleaning and disinfection. Cleaning reusable items. Wash soiled dishes or utensils with hot water and detergent. Clean and disinfect reusable medical equipment, according to the manufacturer's instructions to ensure proper hygiene and safety. Cleaning and disinfection. Cleaning linens and laundry. When handling soiled linens, always wear gloves to protect your skin from contamination, and avoid shaking the laundry to prevent the release of infectious particles into the air. Carry linens by the top to reduce direct contact with soiled areas. Wash soiled items in hot water, at least 60 degrees Celsius or 140 degrees Fahrenheit, using a strong detergent to ensure thorough cleaning and disinfection. Cleaning and disinfection. Cleaning linens and laundry. After handling contaminated laundry, remove gloves and wash your hands thoroughly before touching clean items to prevent cross-contamination. Take extra precautions by wearing gowns if necessary, and handling the linens carefully to minimize the spread of harmful microorganisms. Following these steps helps ensure a safe and hygienic environment. Cleaning and disinfection. Environmental cleaning and disinfection. To maintain a clean and safe environment, it's important to frequently clean and disinfect high-touch surfaces such as doorknobs, light switches, medical equipment, and phones. Use disinfectants that are appropriate for the environment, and always follow the manufacturer's guidelines for dilution and contact time to ensure the disinfectant is effective. Begin by removing visible dirt and debris with a damp cloth or mop using soap or detergent. This step reduces organic material, which can protect germs from the disinfectant. Cleaning and disinfection. It's important to clean these areas more often, especially in high-risk environments to minimize contamination. Environmental cleaning and disinfection. When cleaning, always start with less soiled surfaces to prevent cross-contamination. Once the cleaner is applied, allow it to sit for the recommended time to ensure germs are effectively killed. In high-risk environments, consider disinfecting high-touch items after each use, or multiple times a day to provide continuous protection against the spread of pathogens. Focus particularly on high-touch areas like handrails, phones, bed rails, and other frequently handled surfaces that are more likely to harbor germs. Emergency cleanup procedures. Ensure personal protection. Before cleanup, caregivers should wear gloves, a gown or apron for splash risks, face protection, shield or goggles, and a mask to prevent exposure to pathogens. Contain the spill. Isolate the contaminated area to prevent the spread of infectious materials, and block off the space or close doors to avoid further contamination. Clean the area. Use disposable cloths or paper towels to wipe up the spill. Then dispose of them in a biohazard waste container. For larger spills, start by removing visible debris and excess fluid, then use absorbent materials like spill pads or granular absorbents to soak up bodily fluids. Emergency cleanup procedures. Disinfect the area. After cleaning visible contamination, use an approved disinfectant to clean all affected surfaces, ensuring it's effective against bloodborne pathogens. Follow the manufacturer's instructions for dilution, application, and contact time to ensure thorough disinfection. Clean the area with soap and water, then disinfect using a bleach solution diluted at 110. Dispose of contaminated materials. Dispose of used gloves, paper towels, and cleaning materials in a biohazard waste container and seal it tightly. Ensure the container is properly labeled. Dispose of sharps in a puncture-resistant container to prevent injuries. Emergency cleanup procedures. Wash hands and clean PPE. After cleanup, carefully remove PPE without touching contaminated surfaces. Then wash hands thoroughly with soap and water following proper hand washing techniques. Report the incident. Document the cleanup procedure and report the incident to a supervisor or infection control officer. If there was significant exposure to blood or bodily fluids, follow the appropriate post-exposure protocols for health and safety. Safe handling and disposal of broken glass contaminated with bodily fluids. Handling broken glass contaminated with bodily fluids. Never handle broken glass with bare hands. Use a brush and dustpan or tongs to collect the sharps, and dispose of them safely in a sharps container. Storage of contaminated materials. Storage refers to how contaminated items should be kept before they are properly disposed of. Contaminated materials, such as used gloves, bandages, needles, or any item exposed to blood or bodily fluids, should be placed in leak-proof, puncture-resistant containers. This ensures that any fluids or sharp objects don't leak or puncture through the container, which could lead to contamination or accidental injury. Furthermore, these containers should be stored in a secure location, out of the reach of children and pets, to prevent exposure or accidents. This is particularly important because contaminated materials can pose serious health risks if accessed by someone who isn't properly trained to handle them, especially in a non-medical environment. Labeling of contaminated materials. Labeling is about clearly identifying the contents of containers so that anyone handling or coming into contact with them knows the potential hazards. Contaminated materials should be placed in containers that are clearly labeled with the biohazard symbol. This symbol is universally recognized as indicating that the contents are potentially infectious, which alerts caregivers, cleaning staff, or anyone else handling these materials to take extra precautions. The use of biohazard labels is essential for both safety and regulatory compliance, as it helps to prevent exposure to harmful pathogens. The label should be easily visible, and in a color that contrasts with the container. Example, bright red or orange, ensuring it stands out. Post-exposure protocols. In the event of exposure to contaminated materials, immediately wash the affected area with soap and water. This helps to remove any harmful pathogens and reduce the risk of infection. If the exposure involves the eyes or mucous membranes, rinse thoroughly with clean, running water for at least 15 minutes. This will help to dilute and flush away any contaminants that may have come into contact with these sensitive areas. After taking immediate action, it is crucial to report the incident promptly to a healthcare professional. They will evaluate the situation, assess the level of exposure, and determine the appropriate follow-up actions, including any necessary treatments or monitoring. Congratulations! You finished Module 8. Please complete the quizzes. Congratulations! You finished Module 8. Please